goal for day one was business as usual, and I have to give the frontline staff at all 3 sites an applaud, because they did a phenomenal job in ensuring that it was business as usual. As the patients that came to any of the facilities were not impacted by anything going on behind the scenes with respect to health records transitions and some of the other transitions that were taking place. So I think it's the work that led up to October 1st, is we tried to make the work that actually happened on October 1st not impact the system, and just use that as a day so we can move forward.
Can we just reiterate what the physical changes are and what isn't changing?
So what's happening is Windsor Regional will be responsible for all programs and services that occur at both the Metropolitan and Ouellette site in the city of Windsor, and Hotel Dieu-Grace Healthcare now is responsible for all programs and services at the Ouellette Campus moving forward as of day one.
A little bit of controversy on Friday when we were doing the outdoor physical transition. Do we have any reaction from your end on that, with the removal of the cross and other symbols?
Well, as Ken Dean indicated, those are decisions that are made by the host organization for Hotel Dieu-Grace, and Windsor Regional was not involved directly in any of those decisions regarding what stayed and what was removed. So, for example, certain crosses in the lobby are here, and certain crucifixes throughout the organization still remained, but the issue of the cross on the exterior of the facility moving to Ouellette Campus, that was a decision that was made by Hotel Dieu-Grace Hospital, and I support that decision. And we worked with them throughout this process to ensure that Windsor Regional was not involved in those decisions, in the sense those are very delicate decisions that have to be made by Hotel Dieu-Grace Hospital, and we support their decisions, whichever decisions they want to make in that regard.
What did you think was the biggest challenge waking up this morning?
Waking up this morning. That's a challenge in and of itself. But other than that, you know, the great thing, because people ask, well, did you sleep well last night? I slept fine, because the reason I slept okay, because I know there was people who were here doing the work, and if I start losing sleep, I have to trust the individuals who are here, the frontline staff who are doing this on a daily basis, and they do a phenomenal job. And I know I was involved in a lot of the planning leading up to this, and I know because of their commitment and because of who they are, that they were going to make sure this happened very smoothly, and they did. I have to give them credit. Needless to say, there's always little issues that pop up, but they were able to move those through very quickly, and they kind of saw that they were going to be coming and moved it forward. So from a patient's perspective, there was no impact whatsoever.
Is there any sort of a template for this sort of maneuver in the province? Did you get advice from higher ups, or is this sort of you're on your own?
Yeah, we had conversations about what needed to be done, but fortunately and unfortunately in the province of Ontario, the computer systems or the softwares that are used are very unique. So what you need to do to transition from one day to the next, from one organization to the next, are very unique with respect to the software providers and how you work with that, the underlying system. So we have a lot of systems experts here who live and breathe this type of software and these types of issues and the health records issues. So they were able to transition. Now there are certain rules in place we need to follow with respect to health records transitions, with respect to notice to patients, and those types of things. So legislatively we have to follow certain things. But when it comes to kind of a cheat sheet or a checklist on how to do this, one doesn't exist, but there exists one now, and that's been created by our staff.